All right, Travis, here's first, it's a tweet from Sarah. She wrote, "My boyfriend recently got blood work back from his last physical, and his doctor said his number of white blood cells was elevated. What does that mean?" Why don't you take that, Travis?
Well, it can mean a lot of different things, but think of your immune system as your army, and your white blood cells, those are your soldiers. So we tend to see an elevation in the white blood cell count if you're fending off an infection, either viral, bacterial, or any type of infection, because just like if you go to war, you need more soldiers. If you have an infection and your immune system's at war, you need more of those white blood cells. So usually that's when we find that elevated white blood cell count. If you have a chronically elevated white blood cell count, you do have to worry about things like,
well, if those soldiers are around all the time, they may just indicate, reactions to medications. But actually, sometimes they're just the defense, because in pregnancy, you'll have an elevated white blood cell count, and that's actually normal.
but occasionally, if you have a really, really elevated count,
It could be cancer.
it could be a blood cancer.
Yeah, that's exactly it. I mean, it's just sort of an indicator of the immune system. And you said the most likely cause is infections, whether it's viral, bacterial, but it can be other things. You're going to have a shift in your white blood cell count if it's allergies, if it's cancer would present differently. And another part of these tests, you're talking about sedimentation rate, that can be an indicator of something going on. But if they find something abnormal on your white blood cell count, your doctor is probably going to have a conversation with you about doing additional tests to pinpoint which one of those issues with your immune system are going on.
But usually an elevated white blood cell count is not anything to worry about unless your doctor raises red flags.